there anything in particular that you've seen increase with just presentations or real concerns that maybe the community of psychologists that you guys are seeing now that's different from what you've seen in the past? It's something unusual and something kind of coming down the pike in the way of research and all of that. Can you talk a bit about?
What I'll say, and this kind of goes back to my my mention that I made earlier about kind of how we got to do things differently and maintain normalcy, but people don't always realize it, but you can actually engage in psychotherapy in a video format such as this, right? So a lot of people think that you have to be face-to-face, and guess what? We're in shelter in place, and we can't actually seek out someone because we got to wait until this thing is over. But that's not the case. We actually have to use a HIPAA-compliant version of video conferencing, and HIPAA is just kind of the Health Information Portability and Protection Act, and it protects everyone's information from getting in the hands of the wrong people. And so kind of throw that out there, and that's something that not everyone knows about. Most psychology and counseling clinics these days do have some version of telehealth that's in play now. And so with that being said, it opens up the door for people to not necessarily address anything overly deep to the point where you feel like you have a psychological condition for life. It can just be, how can I vent, and how can I maintain this level of stress that I've never had before in the past, and venting to a professional as opposed to hoping that it just goes away. I like to throw this out there as an analogy. If you were to break your arm, most people are not going to say, oh, well, I'll just wait for that thing to heal. They're going to go to a doctor, and they're going to make sure that their bone is going to repair itself the right way. The same thing is true for your mental health. If you actually have a condition or a set of symptoms that you have not been able to manage on your own, you don't want to let that just go away. You want to, even if it's just a 1 session or 2 session thing, you want to make sure you get treatment for that.
That's great. A couple of sessions of teletherapy, especially during this time. Do you know if they will conduct, or if you can conduct teletherapy for the entire family at once in one session, or does it have to be individual patients, or how would that work?
It's a good question. So different video, HIPAA compliant video formats work differently, but the one that we use in my clinic, we do have the ability to have multiple people there. So depending on which device that they use, if it's a cell phone or a computer, as long as an individual has a device, they can be in different rooms of the house. They don't have to all be hovered over a phone. Pretty well. So a lot of people like that, and they're reporting some benefits from feeling as if they can still get that individual attention.
Oh, that's great. Can be in the same house, each individual screen, but in different rooms, and still, that's the way of the future now. And I think that's a really nice way of introducing therapy to families or individuals who, have been reluctant to consider counseling in the past. And so, one last thing, I really want to just go back to the idea of fear and the mystery of this COVID-19 or coronavirus. I think what the majority of us are feeling is fear, and just that basic fear. What can you tell us about coping with fear? And give us just a few things to remind us about how we can deal with fear.
Well, the first thing is we have to understand that the fear that we're experiencing is not irrational. There is a big difference between an irrational fear and a rational fear. An irrational fear, for example, is that an individual is going to break into my house and shoot up the entire family when you have no indication at all that has happened in your neighborhood or that someone is targeting you. That's an irrational fear. A rational fear is that something has happened, and now you have to react to it. So something has happened. We have COVID-19. We understand that this is not a hoax. This is a real thing. And now we have to make sure that our loved ones, including ourselves, aren't hurt by this thing to the point that we die. And the honest reality is that you don't have to have an autoimmune disease. You don't have to have a respiratory illness. Anyone can be afflicted by this to the point of death. It just is unlikely. And so by all of us experiencing fear, that's our normal human element come into play, because all of our emotions are defenses in a way. When you think about just the adrenaline being pumped in your veins, and you're fearful that this dog is going to attack you. The adrenaline being pumped throughout your body is protecting you and is attempting to protect you and give you some powers that maybe you didn't normally think you had, so that you can get away, fight or flight sort of response. And so this may not be the answer you were looking for, but it certainly is a normal thing for us to experience a certain level of fear, and that fear is a protective factor for us. Now, here's where it becomes problematic, is if the fear consumes you and you can do nothing but focus on that fear, you can't sleep, you can't think, that's where it becomes problematic to a point where it's clinically significant, and now it makes sense for you to work with a professional. Now, here's a piece of
hoarding tissue.
I'm sorry?
And start hoarding tissue and spraying Lysol everywhere. And
Sure. Exactly. So some of those behaviors in and of itself alone might not be diagnosable, but you add in a couple of different symptoms, and now you probably have a diagnosable condition. That's all a diagnosis really is a cluster of symptoms, and it gives us a common language to communicate about. But you're completely right. When we start to see those behaviors, we got to worry at that point.
Okay. So if we're in the supermarket and next to someone grabbing tissue and just step back, move over to the next aisle, okay?
Sure.
Give yourself some room just in case that person responds or reacts or does something irrational, along with the hoarding of the tissue.
I've seen people in the grocery store, I think since COVID-19 has happened, I've seen 2 outrageous arguments in the grocery store. And so it just tells me how pervasive this really is and how affected people are. That to me, and of course this is a psychologist speaking, I don't see these as bad people. I see these as people who have overwhelming stress and they have no effective coping strategies. Therefore, I'm giving you guys some tools that can kind of help you so that you don't get to that point. But as strong as you may think you are and as resilient as you may think you are,
right,
this can, affect you financially, your relationship, your livelihood, your roof over your head, no food. At some point in time, you probably will reach that boiling point as well. So that's why it's important to engage in some of these things and understand that you got professionals that can help.
And or to reach out to you by going to your website, Journey of Life Psychological Incorporated. Or
so, yeah, you can Google Journey of Life Psychological, or you can just merely type in Journey of Life psy.com. And that will give you some resources about our clinic, but there are other clinics that are out there that can, of course, help as well. But of course, San Leandro or Sacramento, we do serve those two greater areas.
And give us the telephone numbers, or at least for one of your locations.
Yeah. So I take all the initial calls, and so the number you can call is 510-463-1302. That's 510-463-1302. And depending on where you are, we can, of course, route you to the right clinician.
Great. Well, thank you so much for joining us, Dr. Outlaw. We hope that you can come back and do some more conversations, because it is ongoing. I'm doing some research about, the Bay Area in particular and what people in the Bay Area are going through. I'm also trying to collect more questions from the audience and, some of my Facebook friends and Instagram contacts who are out there who will see this later on. If you guys have questions, specifically regarding, coping and creating a mental health wellness kind of plan for yourself, send your questions to me. You can send them to aliciamayo430@gmail.com. Or you can reach out to the doctor's offices, and you probably have your email address listed there. Okay, so please send your information, your questions, your comments to us at the Bay Area Mental Health Hour, and look for us on YouTube for other episodes around mental health conditions and coping, along with education, as well as this particular episode of the Bay Area Mental Health Hour. I will post it on our YouTube platform so that everyone can watch it again. Thank you guys for tuning in. Thank you, Dr. Outlaw, for sitting in with us. And we'll have more to come in the future. Any last words, Doc?
I would just say, hang in there, right? We're all in this together, and certainly want to make a reminder about hope and optimism, as opposed to the pessimistic view and the morbid view, even the conspiracy theory view. Sometimes it's not helpful as well. So just try to maintain hope and optimism as much as you can, and we're in this together.
Yeah, we are in it together. You guys look for the Bay Area Mental Health Hour on YouTube. I will post this again at a later date, but for now, stay safe, stay healthy, and stay sane. Thanks for joining us. Thank you for tuning in to the Bay Area Mental Health Hour. Don't forget to visit our YouTube channel, subscribe, and tap on the notifications bell for future episodes.